Diabetes is a chronic medical condition that occurs when the body is unable to properly regulate blood glucose levels. This can happen when the body is unable to produce enough insulin, which is a hormone that helps regulate glucose levels in the blood, or when the body is unable to properly use insulin. Symptoms of diabetes may include increased thirst, frequent urination, unexplained weight loss, blurred vision, and fatigue. If left untreated, diabetes can lead to serious health complications such as heart disease, kidney disease, and nerve damage. There are different types of diabetes. Type 1 diabetes. Type 1 diabetes, also known as juvenile diabetes, is a chronic condition in which the pancreas produces little or no insulin. This means that people with type 1 diabetes must take insulin injections or use an insulin pump to regulate their blood sugar levels. Type 1 diabetes is typically diagnosed in children and young adults, although it can occur at any age. The exact cause of type 1 diabetes is unknown, but it is thought to be an autoimmune disorder in which the body's immune system attacks and destroys the insulin-producing cells in the pancreas. Type 2 diabetes. Type 2 diabetes is a chronic condition in which the body becomes resistant to insulin or does not produce enough insulin. This results in high blood sugar levels, which can lead to a range of complications if left untreated. Type 2 diabetes is often associated with obesity and a sedentary lifestyle, although genetics and other factors may also play a role. Gestational diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy. It occurs when the hormones produced by the placenta interfere with the body's ability to use insulin effectively. Gestational diabetes usually goes away after the baby is born, but women who have had gestational diabetes are at increased risk of developing type 2 diabetes later in life. LADA, also called type 1.5 diabetes. LADA, or latent autoimmune diabetes in adults, is a type of diabetes that shares characteristics of both type 1 and type 2 diabetes. Like type 1 diabetes, LADA is an autoimmune disorder in which the body's immune system attacks and destroys the insulin-producing cells in the pancreas. However, like type 2 diabetes, LADA typically develops later in life and progresses more slowly than type 1 diabetes. Because LADA is often misdiagnosed as type 2 diabetes, it is important for doctors to test for autoantibodies that are present in type 1 diabetes. Next one is maturity onset diabetes of the young, abbreviated as MODY. MODY, or maturity onset diabetes of the young, is a rare form of diabetes that is caused by mutations in specific genes. MODY is typically diagnosed before the age of 25 and is often mistaken for type 1 or type 2 diabetes. Finally, secondary diabetes. Secondary diabetes is a type of diabetes that is caused by another medical condition or medication. For example, people with cystic fibrosis may develop secondary diabetes due to damage to the pancreas, while people taking steroids for another medical condition may develop secondary diabetes due to the medication's effect on blood sugar levels. In some cases, treating the underlying condition may improve blood sugar control, while in other cases, insulin therapy or other medications may be necessary. In conclusion, treatment for all types of diabetes may include lifestyle changes such as diet and exercise, as well as medication and insulin therapy in some cases.